a wall which makes the separation between the oral cavity and the neck, below the urethra. And here you can see the anterior belly of the digastric muscle. I'm going to put of this anterior belly this way. So this digastric muscle is ending inside a mandibular fossa, the gastric fossa. That is it. And behind this anterior belly there is an intermediate tendon this way, and this intermediate is connected to the urethra. So we also have to represent the submandibular gland, which is located here. And we will show also the vessels. So there is the facial artery, which is in close contact to the mandible in this radiation, giving some vessels of the submandibular gland, and also giving a branch, which is called a submandibular artery. And this artery is contributing to the vascularization of the inferior border of the symphysis. That's why, in some cases, if you make a perforation, actually you don't, but if you make a perforation in the inferior border of the symphysis, it can be responsible of bleeding. And this bleeding will give an hematoma, a subcutaneous hematoma under the chin. That's why when you make a bone harvesting in the symphysis, or if you have a perforation here, you have to put a dress compressive, to avoid this hematoma. But it's not a very pejorative hematoma, because it is just a subcutaneous one. The other artery that gives vascularization of the symphysis is more important to describe. So let's see another lateral vision of the maxilla. The urethra. So you remember the tone, the division of the carotid, the common carotid artery, will give a lingual artery, which is coming to the tongue, and this lingual artery will be medial to a muscle, which is the glossus muscle. And it will divide in two branches, a deep lingual artery and a sublingual artery, this one. This sublingual artery is coming inside the bone, inside the symphysis. Sometimes you will see there are some canals. And of course, if you put an implant in some of these branches, it can be responsible for a small bleeding inside the bone. No problem in this case. You just stop the bleeding, you just have to put the implant. So you know how to do it. But in some cases, if by accident there is a perforation of the posterior cortical of the symphysis, it can be responsible of an important bleeding here in the buccal floor. It is quite a pejorative bleeding, because in some cases when it is important, it can be responsible with difficulties. So if it is occurring, you have to take precaution to take the patient with you and to have a look on him, because it can be dangerous. The other element that I can show you here is the submandibular nerve, you remember, which is giving a left canal here. And also, I just want to show you, important for the anatomy for this afternoon, the lingual nerve. The lingual nerve, which is coming, just medial to the mandible, which is coming in very close contact to the submandibular duct, to the tip of the tongue, and which is giving some nerves to the submandibular duct. Perhaps we will see that on the dissection. So the symphysis, with a very rich vascularization from the mental foramen, from the submandibular artery, from the sublingual artery, and also from the incisive artery, the incisive pellicle inside the bone. So you understand it can sometimes be. To finish with the mandible, I'm going to show you the last drawing, which is a vertical section of the submandibular area, exactly in this place. A vertical section this way, as a CT scan. So let's do the vertical midline, the tongue, we will not give all the details of the tongue muscles, and here is the section of the urethra. You recognize here the glossus muscle. I will show you to the gastric tendon, passing in close contact to the urethra, and laterally we will see the mandible. In this area, floor. Here you can see the below muscle, and here is the submandibular gland. That is the most part in the neck, but also inside the buccal floor, as you can see. The elements that are important to consider are the vessels, of course, and you will have here the facial artery. You remember it. This facial artery is just passing here close contact with the nodular, but you remember that it is extra periosteal. No problem if you are under periosteal. You also have the facial vein, which is passing lateral to the gland, different way than the artery. And you also remember that you have the marginal ramus of the facial nerve located lateral to this vessel. Take care if you have to make hemostasis in this region. The problem, the element to consider is that if you make bone harvesting in this region, the problem is the location of the nerve, of the inferior alveolar nerve. And the more you are anterior, the more it will be lateral. So you can check its position with the perioperative CT scan, of course, and it's important to use piezoelectric microphones because it's less traumatic for the nerve if you are in contact with it. So I think perhaps it's enough for the drawing now. Yes. Not too much. Not too much. I have to stop. Do you have questions about that? So I keep the drawing, and after the course I will edit. I suppose there is a way to
الحنك العلوي والسفلي تسبع مشهد
بعرف مش خاصة اللي فوق ترى هذا تموت هذا يسوي نزيف دايما
هذا الموضوع شريان
مو موضوع شريان أنا قريت عنه هذا بيقتل مو مشان النزيف بيقتل لأنه بيسكر مجرى التنفس بصير تجمع دم بين المثلث وبين بيوقف التنفس.
هو دكتور ولا بروفيسور؟
فن
عشان يشوف الإكسراي؟
بروف.
If you have a bleeding in the artery here, what we can do?
Yes. So the question is, if we have a bleeding in the buccal floor,
yes.
What to do? Well, it's difficult to manage the problem alone because sometimes it's a small bleeding. So you can just have a look at the patient, and if there is no breath problem, you keep him in the clinic quiet, and sometimes, in most cases, it will be okay. But if the bleeding is very important, and if there are breath difficulties, you have to send him to the hospital to be in the emergency room, you know.
In the clinic we can't do anything.
Because it's difficult to make the hemostasis. If you make an incision in the buccal floor, it will be more, and you
Bleeding.
will get more and more edema.
Yeah.
And sometimes it is worse than doing nothing. So the problem is just a problem of breath. The hematoma will stop. That's not the problem. The problem is just to check the breath. And if it is okay for the breath, no problem. If there is a problem with the breath, or if you worry about it, you can send it to the emergency room.
In posterior upper,
And in
posterior artery ballot.
Major
for the,
bronchitis.
So
the
it's
great
dangerous.
palatal artery, although in most cases you just have to make a coagulation, no problem. In most cases it will be okay. You know.
No,
there-
because I see some cases that it's very bleeding.
Yes, but with the coagulation, in most cases it will stop. If it doesn't, you can make
Suture
for artery.
Suture.
For artery.
Yes, on it. But it's sometimes difficult to make the stitch if you have cut the artery in contact of the bone.
Yeah.
So the coagulation is easier. It's easier. And if it doesn't stop with the coagulation, you can try to make
Coagulation
it.
is also-
Yes.
Maybe this two cases only hard to stop.
If you do that, it will stop.
difficult to stop.
Only these two cases, upper and
Yes.
this.
Yes. The other bleedings are not very
Still on.
important in the area of our surgery. Yes.
Yeah.
Yes. Other questions?
Thank you.